Hey guys, so I'm Kathy Kellogg. I'm the lead intake and marketing specialist here at Support Inc. I just wanted to thank everybody for joining us today and hopping on this webinar so we can learn more about the services that the nurse team provides here in-house. On the nurse team joining us today, we have Morgan, Erin, Nicole, Jamie, and Lauren. It's my understanding that Morgan's going to be leading the bulk of the PowerPoint, and then you'll probably hear some feedback from our nurse team as well. If you have any questions or concerns, we'll save those for the end of the presentation. So the PowerPoint probably lasts maybe half an hour or so, and then we'll open it up to questions and comments and discussion after that. And so with that, I'll just kick it over to Morgan and the nurse team if you guys want to introduce yourselves, and then we'll go ahead and get started.
Thanks, Kathy. As Kathy said, my name is Morgan Struck. I'm the Associate Director of Nursing. I'd like to talk about a little bit about myself and my history as a person working with people with intellectual and developmental disabilities. I've been in this field for approximately 13 years at this point. I come from humble beginnings. I like to say I started as a direct support professional working at the Easter Seals Camp in Colorado at Empire. Absolutely loved this population. It was after I graduated with my psychology degree and decided to stay in Colorado and also work with this population. So after that, I got my nursing degree after like 4 or 5 years in the field and became a host home provider, residential program coordinator, the gamut of jobs. The only job I haven't done is nurse case manager. And now I'm currently working on my master's in nursing to kind of advocate for policies and mental health for this population. So if you have any questions about that, feel free to reach out, but just a little bit about myself. And I'll pass it over to the rest of my team, whoever wants to go next. Oh, and I've been with supporting for 5 years as well.
I'll go next. Sorry, Nicole. I'm Erin Gordon. I'm one of the nurse case managers on the team. Started in October, so I'm a little bit newer to support. I am the nurse case manager for Loveland, DM1, DM2, and DM4. And I'll pass off to Nicole.
Hi, everybody. I'm Nicole. I've been with support for about a month now. I am the new medical coordinator. I work with DM3, DM4, and Loveland teams. And yeah, super stoked to be here. And Jamie?
Hi, everyone. I'm Jamie Weidman. I'm the other medical coordinator. I work on DM1, DM2 in Colorado Springs, and I've been here for a little bit over than a year. And I will pass it off to Lauren.
Hi, I'm Lauren. I'm a nurse case manager. I am in charge of DM3, Colorado Springs, and Pueblo. And if anyone's wondering why I have a black eye, it's because my toddler headbutted me. So that's been fun. I'm currently getting my bachelor's in nursing, and I've been with support for a little over a month. So
nice. And
awesome.
I honestly did wonder, so thanks for clarifying.
All right, I'm going to go ahead and share the PowerPoint and get to why we're all here today. Did I do it correctly?
Yes, thank you.
Okay, awesome. All right, so supporting nursing services. So we want to give you guys a big picture overview of what we do at supporting for our nursing services. So traditionally, nursing services are not covered under the IDD waiver. So they come from the residential budget. So it's not necessarily a requirement for an agency to have a nursing team, but supporting strives to bring high quality services to individuals with intellectual and developmental disabilities in our community. So to be able to do that, that also includes the medical services that we provide. And that comprehensive holistic patient care involves that medical care. So our agency provides that much needed nursing support to these individuals, not only with complex medical needs, but from all backgrounds. So we are here to provide services for our community from a medical perspective that not all agencies actually provide. And as you know, we introduced everybody. So we've got myself, Erin, Lauren, Nicole, and Jamie. We actually started when I started here, it was just me and one other person. So we've vastly grown with the capabilities to be able to support the people in our services. So why are nursing services really important to the people that we work with? Advocacy is so important because there's a high number of health disparities in this population, way higher than the average population. So as an agency, we're focused on providing health equity. So some of the things that people with intellectual and developmental disabilities struggle with more than the average population, or they're more likely to report being in poor health. They have a shorter life expectancy than the general population, less likely to receive preventative screenings, vaccinations, and health promotion, higher rates of undiagnosed hearing and vision impairments, higher rates of obesity, higher rates of poor dental health, higher rates of diabetes, arthritis, cardiovascular disease, and asthma. Most common causes of death differ from the general population and show higher rates of mortality due to illness conditions less likely to lead to death in the general population. They're more likely to have poorly managed chronic health conditions, higher rates of prescribed psychotropic medications, and people needing behavior support show a higher rate of many health disparities than others in the IDD population. So it's really important that we focus on these things to help promote best patient outcomes. So what are some of the services that we provide at Support Inc? So just a little history about people with disabilities and institutionalization. I'm sure many of you are familiar with, in 1972, people with disabilities began to be deinstitutionalized from those settings. In order to be able to provide that comprehensive care in the community, that also involves high medical nursing care. So we actually have some states in the United States that don't allow nurses to be able to delegate care. So we have people still living in facilities and group homes in places like Illinois where the person doesn't really have a large choice in where they live because they have diabetic needs such as insulin and glucose testing, where only a nurse on site has to be there to be able to provide that care. So we're lucky enough to be able to provide what's called a delegation to lay people in the community to provide those services such as insulin, glucose testing. And under the Nurse Practice Act, a nurse may delegate any task that is in with the scope of the practice to any unlicensed or unregulated person. And like I said, so insulin, glucose testing, G-tube, J-tube, we have some people that we delegate for trach care, C-tube, and many more things that we help provide services for. And then we also provide care plan management. So you may wonder, like, how do we regulate all those cares that go along with those delegations? So those are our care plans, and those are written with a focus on person-centered care and planning. They align with the diagnosis, but they're very specific to that person. We also provide consultation services to internal and external providers and caregivers. Oftentimes we're pulled into cases where an individual's condition might have changed, and we're consulting with not only a hospital, say that they're hospitalized, but also with the caretaker to provide training and making sure we fill those gaps, such as maybe they need a PT/OT referral or wound care management, making sure those referrals are in place before they're discharged from the hospital. And also care coordination. So making sure we're getting those trainings and coordinating with services and through communication with interdisciplinary teams, caretakers, and medical providers. Our trainings include not only for delegations, but non-delegatory care, such as catheter care, ostomy care, just general diabetic care needs, many more things. We do our QMAP trainings, so qualified medication administration personnel training with every single person that comes through their agency, as well as the medication reminder box training for anyone in our services. And then comprehensive case management. When our team's coordinating cases, we look at all the relevant factors in a person's care to make sure that we are providing that holistic, whole patient, person-centered care, and making sure all those pieces to the puzzle come together to help guide our treatment practices. So some of those health relevant trainings that we've looked at. So like I said, comprehensive care is very important to us. So we like to look at higher picture things that are going on. One of the things that we look at is, say that we have somebody like recently last year, we had a lot of people with bowel obstruction. So we were like, well, what's going on with that? So we decided to implement more care plans, more tracking, more training for people so that they understand exactly how to help care for that person. So looking at those trends about what's going on with people in our community, and constipation is a fatal 5 diagnosis. Those fatal 5 diagnoses are causes for premature death in this population. So those things are such as seizure, constipation, GERD, aspiration, and dehydration. So using that information that we know and that's actual raw evidence-based data, the fatal 5 diagnosis is the leading cause of unpreventable death in people with disabilities. We use that with, things that are happening within our organization to implement that tracking. And we had actually saw, since we implemented that, a reduction in those cases of bowel obstruction, because constipation leads to bowel obstruction. So it was actually really rewarding to see that those cases were minimized due to that implementation strategy.
I'm trying to listen to a webinar, but I can't get the sound to work.
So using,
Yeah, I can see the slides, but I can't get the.
Kathy,
Okay.
did you want to text
Muted,
that
yeah.
person and help them?
Yeah.
Okay. We also provide comprehensive oversight and training for high-risk medical care, such as diagnosis, like we talked about, and medications. Like if somebody's on a blood thinner, we want to make sure that we have additional care plans in place and that person understands the complexity that goes into some of those high-risk medications, as well as implement tracking to guide best treatment, such as seizures, tracking blood pressure, blood glucose, to make sure that those medications are therapeutic, because we don't want to just unnecessarily treat people. There's a lot of polypharmacy in this population, and we want to make sure that the treatment guidelines that are being recommended are adequate, and advocating if they're not adequate, right? They don't need to be on 6 psychotropic medications if it's not effective. So oftentimes a lot of our job is advocating to make sure the person is getting the right care within the community providers. We put a big focus on innovation. So I'm a very big process improvement person, so I'm very conceptual. I like to use the health resources that we currently have to promote these best patient outcomes. So we are very driven by data. So our quality assurance team recently started collecting all the health and safety data. And since we implemented our completed projects, we've had a 19% audit score go up since the implementation of those projects. And so with a focus on health informatics and utilization of data tools, we're available within the healthcare realm. We continually strive to implement technology to improve our processes and ultimately improve these patient outcomes. So some of those completed projects were the health tracking process. So training not only the RPCs and the providers about what we talked about with blood glucose tracking, seizure tracking, the importance of when you actually collect that data, we can track it and bring it to the primary care provider, neurologist, whoever, so they can also help guide those treatment outcomes. So us helping to train people the importance of why those things are there and available. We also implement a new appointment tracking process to help people know when those appointments are due, right? So somebody may not know, like, oh, that person's due for a colonoscopy at this time or a mammogram, and helping to track those things for people to know when those things are due. And then one of the biggest projects we did last year was the pharmacy integration program, where we are working with Terrytown Pharmacy to be able to integrate the pharmacy actual portal with TheraApp, so those two talk together, so the meds come to us in real time when they're updated. So that project is still, it's almost complete. We just need to get over the last hump of the data in TheraApp, the data push in TheraApp. But these processes, just like I said, it helped to improve our health and safety outcomes, which went up 19% last year with these projects. So some future projects that we're hoping to work on is more utilization of those healthcare tools. What other health informatic tools are out there where we can collect data to be able to help guide best treatment approaches? And then to maybe develop some more community partnerships. I know that a lot of people struggle with getting DMEs, or one of the big things that we struggle with is getting wheelchair assessments. So how can we find providers in the community where we can partner with them to be able to provide those services to you guys, so you're not like, well, where do I go for this wheelchair assessment, because they don't want to come out and we're not going to name company names, but they don't want to come out and do the assessment, right? So that can be a very difficult when that's a requirement from the state. And then one of the other big things is ensuring those care plan templates are aligning with current practice guidelines. So we always want to be updating everything to current evidence-based practice, right? Because medicine, with data and the way things are going, with healthcare, it's actually within 3 to 5 years, most practice guidelines are out of date within that time frame because of how fast technology and information moves in this field. So making sure we're always up to the best standard with those guidelines. And so the supporting difference. So what do some caregivers say about us? So I just want to read a card that we got from a caregiver. She said, "Thank you all for being here for my son and I. Just by looking at all of your names on the list as our nurse team and receiving your emails, I know that we are not alone. Reporting every single paperwork I get from my son's doctors gives me comfort and strength. So you are all already doing so much for us as we keep moving forward with your help. We love you and appreciate all you very much. What an excellent job you all do, and what joy it is for me to be accountable to all of you." And then there's some other quotations here, some other people that have been pleased with the support that they give. I think the general statement is that people just feel like it's nice to have an extra set of eyes, especially people who are trained medically, to look over these things and make sure that the best information is coming out from doctors' offices and providers, because it can be pretty scary, especially with all the comorbidities that people with disabilities may have, to understand exactly the best way to approach a new diagnosis or medication changes. So it's really important to families to have that extra set of eyes.
Totally.
And so why choose supporting? So on the nursing side of things, we provide nursing oversight for all our new admissions. We review all the cases at least annually and more frequently for high medical cases. And there's a nurse and medical coordinator assigned to each caseload, as you heard in the beginning of this presentation. And then medical coordination, medical review of all documents by the nursing staff when they come in, and dictation of those notes to each jargon. It can often be difficult with all of the things the doctor may put into a report, exactly what is going on, what the follow-up needs to happen. So helping to break that down for families is really important. And updates in the chart, so all team members are aware of those medical changes. That's vital, obviously, in an emergency or change in caretaker, because someone may move homes a couple or 3-4 times a year if there's a lot going on with them, and they may have some instability. So making sure that there's that continuity of care and there's that resource that a new provider can look into the chart and find that information to make sure that's updated. And I went through that really fast. But that's a pretty high level overview of the services that we provide. I'm happy to ask any questions or answer any questions that you guys may have.
Yeah, thank you so much. I like the high level overview. I think that helps explain to future families what their services could look like with us. And then we also have some new employees internally, new families that join us all the time. So I do think it's a helpful training for some of the newer folks that have joined us recently, just to get a sense of what the team actually does. I do have a question. So for the registered nurse and for the medical coordinators, what's a typical day in the life look like for you? And I know there's no such thing as like typical, but like what would that look like for a registered nurse and also for a medical coordinator?
Go ahead, Erin.
Okay, cool. So it really is very different every single day. We have team meetings. So each of we have, like we talked about, we split up our districts of where we provide care for. So most days we have meetings with the teams that we work with so that we can talk to your RPCs. RPCs typically, I think the caseload is up to 15. So they have a closer eye on the people that they have. So we communicate about what's going on in the background just to make sure that we're providing support. Working on care plans like Morgan talked about. And so when we get into the chart and we start doing their care plan needs, we're also looking into all of the appointments that have happened, generally doing more of a deep dive so that we can find things. And especially like Morgan talked about, some of our folks have a lot of medical acuity, and it helps to have a second set of eyes because specialists can be great, but they don't all talk to each other. So you may have someone who's got a nephrologist, hematologist, a PCP, multiple different doctors. and they probably aren't communicating to each other on what's going on. So you, with support, you have a nurse that's looking over all of those things and seeing how they could potentially interact. So when we do that, that's more of a deep dive. It could take a lot of time, but I think it's really important. Going out to the house to do delegation, I really like to meet with my delegations in person whenever I can. So home visits with people. I've got QMAP training, meetings with people over Zoom just to see if they have any questions, if they've got a loved one who is going into the hospital. And then, things come up, people get hospitalized, and that can take a lot of time of just calling to check in with the nurses every day. If I've got someone in the hospital, I want to check in on them. And talking to the family and making sure that when they're discharged, that all of their needs are going to be met, because they can change while you're in the hospital. So it's a wide range of things. I probably haven't covered everything, and it really is sort of like all of the care support is very person-centered. Our day kind of reflects that, because needs arise when they do, and you just have to be able to meet them when they come up, and they're always different. I can let Lauren weigh in if she's got anything else. I think I said a lot of things.
The only thing that I would add too is just like when there is like a complex situation going on, it's like it's such a team approach, especially from the support side. So we had a instance yesterday where the family needed a lot of support with a complex situation, and Aaron and I were coordinating, and then a residential director got involved, our quality assurance person got involved. So it's a lot of all hands on deck to make sure that that family is being supported from not only our perspective, but the rest of the organization as well. So to have that support, to be able to everyone just drops everything to help on a case, is just, it feels amazing.
Absolutely.
All right. Was there anything you wanted to add, Lauren?
I was gonna say, I feel like Erin covered it all. I feel like for me, my day to day, I sit down and try to start my day the same way every day, but it's impossible, which is not a bad thing. I think with this job, you just have to be willing to be okay with change, which is a good thing. And I really just want to say that this is like one of the first nursing jobs where I actually feel like what we do makes a difference. And it feels really amazing to be a part of not only like the nursing team, but just support in general. Because like with the RPCs and everybody else, I am building such personal relationships with everyone, because at the end of the day, like all of our parts are so important in taking care of the people that we're taking care of. So that's all.
Yeah, completely agree with that. I've been here now for close to 7 years, and I'll always tell people that I stay at this agency because it does feel like what you're doing on a day-to-day basis makes a difference. So I appreciate you saying that. Jamie, what do you feel like your job looks like on a day-to-day basis, even if it's not like super consistent?
Right, it is not consistent, but I would say the medical coordinator is very much day-to-day operations of the nursing team, checking all the emails, all the documents, all the orders, checking for diagnoses, med changes, allergies, really just getting a good holistic picture, medical picture of whoever's in our services, and passing it along to our nurses to look out for.
Sure. Is there anything you wanted to add to that, Nicole?
Yeah, I mean, I feel like our day-to-day is just making sure that everybody gets the information that they need. That coordination of all of the roles. We're kind of like sorry if you can hear my dog whining in the background. That's what that is. But yeah, just I think that's the coordination part, is just making sure everything's up to date, documented well, MAR's up to date, so that people are able to document from their homes what's necessary. Yeah, and just keep everyone updated and connected.
I think it's also important to mention that not only are the nurses and the medical coordinators working with our internal customers, but they're also helping the intake team with pending admissions and folks that we're trying to bring into services. And a lot of them have a lot of specific medical needs, kind of need their opinion, if it's somebody that we're able to serve, if we have the right host home provider. So their job at Support Inc. is huge. It's not just our internal individuals. So, and we appreciate them every single day.
I want to add that it is also really cool because Morgan, Aaron, and I all have different backgrounds in nursing. We've all done different things, and I think that that's also a really good thing because it brings just a different eye or three different brains looking at the same situation and coming up with three different outlooks, and it's, I think, really beneficial too.
Mm-hmm. For sure.
A really good point.
Yeah.
I think that that's like so valuable to have people from different backgrounds so that you have that different approach, right? So like you're not all just doing it and looking at things the same exact way. I completely agree with that.
Yeah, it's more of like an integrated perspective. Was there any questions that anybody had for the nurse team? Also open to feedback, compliments only.
Looks like we have a chat from our new RPC, Brendan. How you doing, Brendan? If you want to read that.
Sure. Yeah, I just wanted to add that I'm a new RPC, new to Support Inc., and I have been just so grateful for the whole nursing team. There's just like so much constant communication, and I feel that like they just take such a load off, like so much stress away from me, because I don't have to worry so much, and like someone else has eyes and they're like helping me work through things and just really ensuring like the absolute highest quality of care for people. And I really can't see that quality being possible without them. So thanks so much, you guys.
I totally agree. It worries me that there are agencies out there that do not have a nurse team, honestly. I just can't imagine how our agency would operate without one. And I know when I first joined the agency, I think we had like one registered nurse and one LPN, and that was it. So the fact that we were able to expand the services and add medical coordinators, so we have an additional set of eyes on any sort of complaints or symptoms or concerns that someone might be having. I just think it's so beneficial to the people that we serve. And then intake, if we ever have any questions, they're there to help us, or new RPCs. It's just really beneficial to have that additional resource built in-house. So yeah. Did you have a question, Meredith, or were you going to chime in with something?
No, I didn't realize I was unmuted, honestly. I'm sorry.
Sounds
Been
good.
here 5 years. You'd think I'd figure that out. Nope.
No, you're good. I just try to call on people if I feel like they might struggle to speak up or something like that. So
Well, thank you for that. But no, I made a mistake with unmuting. But it's been really interesting to hear all the different pieces of it. Like, I'm aware of it. I have been at Supporting for 5 years, but hearing all the different intricacies of it is still always mind-blowing and also really, really cool. And I don't think I realized that like other agencies didn't have nursing teams until today. I think I just assumed that it had at least somebody, but so it's nice that we do have the nursing team and that they are all so on top of it always. Like I don't think I've ever encountered it a situation where the nursing team wasn't able to help with something or help figure something out, and we're just so responsive so quickly too.
For sure. So I have a question for the nurse team. So I consider this to be like a value added service. Like the main service we provide is the residential piece. When it comes to like your job and the things that you do on like a daily or weekly basis or whatever, what do you think is like the most important component that you can offer to a client that people like don't know about, or like maybe they don't realize it's something they can tap into with you guys?
I think it like is the just that consultation piece, but I feel like a lot of people know that, maybe they don't know that, but I don't know if I think that there's a lot of trust, not to okay, let me start over. just going back to, the health disparities, which are very large for underserved populations and even larger for this group. And you add being, under the poverty line, as well as having disabilities, not being able to advocate. There becomes challenges with community providers and providing the best quality services. So we help to advocate for those things, and we're not afraid to do so. So I think that that's a huge piece that I think people should know is like, sometimes somebody gets discharged from the hospital and you're like, why did you discharge them? Or these notes come over and you're like, you discharge them with, or they went to the clinic when they had a blood pressure of 170 over 100, and you're, which for anyone that doesn't know, normal is 120 over 80. So that's very high, and there's no treatment that's implemented. So we often look at those things, and then we'll reach out and say, hey, what's going on with this? Why is this not being treated? So I think that our people often get overlooked. There's like just a lot of that preventative healthcare is not necessarily seen as important with this population. I mean, in my health disparity and health equity presentation that I did, shockingly or not shockingly, during the pandemic, when life-saving resources such as ventilators were when there was only a little bit of them, people with disabilities were on the bottom of the list for getting that support. So it just shows you kind of like how the general medical community sees our population, and how it's so vital for us to look at the paperwork, the things that come through, listen to the families because they know them the best, and advocate with community providers and say, hey, this isn't right, you need to look at this again, or get a second opinion, because it's so often that the medical system fails our people.
Mm-hmm. For sure.
I'm so passionate about it. I'm getting like goosebumps.
Yeah. I see Nicole, the host home provider, like shaking her head knowingly.
I totally agree. I totally agree. And the nursing team has been amazing with that. I've had some really tough clients that needed some assistance and needed to be treated at the hospital. And I've had the nursing team right there with me and supporting, as being a host home provider, you look around like, if the hospital's not going to help me, who's going to help me? And the nursing team was right there to help me out. So yes, yeah, amazing.
Yeah, we want to make sure that our providers don't feel like they're out on an island by themselves. So like any sort of advocacy that we can do to help ensure that the stay is the length that it actually needs to be, and you're not being pushed out. Like we definitely want you to feel like you're supported in those moments.
I'm huge at advocating for my clients. I'm huge at it because like if they can't speak up for themselves, I'm their voice. I'm a host home provider. Yeah.
For sure.
So, and the nursing team was right there to back me up. So that was amazing.
Good. I'm so glad to hear that.
Mm-hmm.
Lauren, did you have, or
I
sorry,
think Joanna has a question.
do you have a question, Joanna?
Yes, I
Hi.
have a question. Hi. I have a question about the mask, because Ben had a prescription since November, Prozazine, and it's not on the mask. I've been trying to get for them to add it to his other medication on the mask, but from November, it's still not there.
It probably be possible that we just don't have the copy that ordered. Joy and I can reach out to you separately after this, and we can figure that out.
Thank you.
Thanks for
That's
letting us
all.
know.
Mhm.
Yeah, thank you.
Thank you. All right.
I wanted to piggyback on what Nicole said. As a host home provider and as a family member, my son was in services, and you'd be amazed at going into different doctors' offices and they don't look at them, they don't touch them.
Mm-hmm.
They really just look straight at the parent or the host home provider. And so that's a whole nother piece that not a lot of people understand. It's not like, and of course, there's always exceptions. And my son had really good doctors, but he also met some doctors that just were kind of taken back, didn't know what to say, didn't know what to do.
Mm-hmm.
So I just wanted to mention that it helps with our nurse team and our great host home providers to continue to advocate for the best care.
Mm-hmm. For sure. And one thing that I like about the agency as a whole too is just the emphasis on the person-centered care, talking directly to the person that you're working with, treating them like they're human, just like anyone else. So, yeah, agreed on that. Any other questions, concerns, anything that you need clarity on? Hi, Erin. Yeah, we allocate like a full hour for these meetings. I don't mind hopping off early if that's what it boils down to, but we certainly have more time if there's like any questions or concerns, anything like that.
I mean, I could talk all day about this, but I didn't know how long to
Right.
make the PowerPoint.
Yes.
I can get on my soapbox some more if you'd like.
I wanted to put in a quick plug for this movie. It's called Crip Camp. So if you're new to this field and you're not super familiar working with people with intellectual and developmental disabilities, it had been on Netflix, and it walks you through the history of like the ADA in this country and what did services used to look like now, look like back in the day and what they look like now. And so there have been some accomplishments, but still obviously a long ways to go. There was the movie was actually featured at the Sci Film, the place in Denver last year, and then we got to see one of the guys that was in the film. He like zoomed into us in the theater and was like answering questions and stuff, and it was really cool. So it's called Crip Camp. I'll go ahead and put that in the chat. I feel like that
And I
should be
think
like mandatory to watch when you join this field.
absolutely. And I think just as I mentioned earlier in the presentation about how the reason why I know about other states and their nursing services is I go to the national conference for people with disabilities and meet nurses from all over the country, and a lot of them work in group homes and at institutional settings still, and they are like, what, you can delegate insulin, like what, and it's like people don't, and that reduces the choice of someone to be able to live in the community where in the setting they want to, because that state does not allow the nurses to be able to do that. So I think that's just huge. I'm so grateful that we're able to delegate lay people to be able to have people live safely in the community, because that just blows my mind that and that's a lot of, like I would say the majority of nurses I meet, a lot of them just work in facilities because the nurse has to provide that care. No one else can provide that care. So it's just really unfortunate that we still have a long ways to go. Like you're saying, Kathy, like even in Colorado, obviously there's a lot of things we need to work on with mental health services, but in the United States as a whole, like how much work we still need to do to get people to live independently and have those choices in where they live in the community.
And I remember onboarding at least 1 or 2 families last year, right? That came from other agencies very similar to ours, where they said that cannot be delegated in the community. And there was some sort of misunderstanding on their end, but we were able to make it work. So even from a Colorado standpoint, there's still some confusion when it comes to those things. So.
Yeah. And I could speak to that just because of us coming into the Support Inc. family. Morgan and I went rounds on stuff because we had understandings of certain things that we didn't know that Morgan could delegate to us. And now looking at it, having all that support and the ability to where Morgan's allowed us to let Lauren do delegations and stuff for myself and my staff, that has opened up quite a bit more, where I'm not bugging Morgan like every single day with questions.
You can bug me all day long, Mark.
Oh yeah.
So how does that impact the quality of care in your day program then? Does that allow for more opportunities for people to go out into the community and things like that?
It does. Most of it's tied to the stuff with as far as the diabetics, which we've been able to get through a lot of that, and Lauren's helped me, and the ones that do any blood sugar tests here, she's been able to come and review and do the delegations. So I gotta deal with the client, so give me 1 second.
And so for people that don't know, Pueblo recently joined the supporting family in October, was that 2022? So not so recent, but within the last year and a half. And so there was a different nursing structure there as well, where it was very stringent and only certain things could be done. And, you know, we came in and we're like, well, actually, you can do all these things. So this person could get more support with the diabetic needs. And we were able to delegate. We had a G-tube person with a G-tube that attended the day program as well. So, which had never happened, as far as I know, before that, Mark.
No, we had
Okay.
we had like 3 G tubes long time ago. I'd say right at when I started about 9 years ago, there were 2 that we were dealing with, but there was only a limited number of staff that the nurse would allow us that would allow to provide the G tube training. Morgan came down and we trained my entire staff.
Oh, good.
And that client, God bless her soul, she was awesome for the short period of time that she was with us. And everything Morgan did with Morgan had the client rolling on the floor laughing the whole time she was working with her. So it was pretty cool.
Nice to incorporate some humor on the job. Cool. Well, was there any other questions or concerns before we hop off of here? Any feedback anybody wants to share? All right, I'll go ahead and let you guys go. And I just wanted to thank everyone again for joining us. And thank you so much, Morgan and the nurse team, for putting this presentation together. We really do appreciate it. For anybody that's unable to join us today, this is recorded. And so we'll wrap this up here soon, and then I'll get it shared to YouTube. And then anybody that's on here, if you want to share this link with people in the future that have any questions or concerns, then you're welcome to do so. So we'll go ahead and stop recording.
Thanks, everybody.
Yeah, thank you so much. And hope you guys have a nice rest of the day.